If you've been standing in the supplement aisle holding a bottle of zinc in one hand and a caffeine shampoo in the other, wondering which one is the real answer to your thinning hair, this may be the moment that finally brings clarity, because caffeine and zinc are not competitors. They don't do the same job. They don't even operate in the same biological neighborhood. And once you understand that, the confusion starts to dissolve. Let's begin with something foundational. Hair is not just a cosmetic feature. It is a biologically active structure produced by one of the most metabolically dynamic mini organs in your body, the hair follicle. Each follicle cycles through growth, transition, and rest phases. During the growth phase, called anagen, cells at the base of the follicle divide rapidly, producing the keratin that forms your hair shaft. Rapid cell division requires energy, nutrients, oxygen, and hormonal signaling. When any of those inputs are disrupted, the output changes. Hair may thin, shed, or miniaturize. Now, here's where zinc enters the picture. Zinc is an essential trace mineral. It plays a role in over 300 enzymatic reactions in the human body. It is critical for DNA synthesis, cell division, immune regulation, protein production, and wound healing. In other words, zinc supports the fundamental processes that allow tissues, including hair, to grow and repair. If you are deficient in zinc, your body cannot optimally produce new cells. Since hair follicles rely on rapid cell turnover, deficiency can push follicles prematurely into the resting phase. This can lead to diffuse shedding, often categorized as telogen effluvium. In more severe cases, zinc deficiency has been associated with certain forms of alopecia. But notice the key word here, deficiency. Zinc corrects a problem when a deficiency exists. It restores normal biological function. It does not typically enhance hair growth beyond your genetic baseline if your levels are already adequate. Think of zinc as maintaining the soil in which the hair follicle grows. If the soil lacks nutrients, nothing thrives. But adding extra fertilizer to already healthy soil does not necessarily produce superhuman crops. It simply maintains balance. Now let's turn to caffeine. Caffeine operates in an entirely different domain. Rather than acting systemically as a nutrient, caffeine, when applied topically in shampoos or scalp solutions, interacts locally with the hair follicle. Research conducted in laboratory settings has suggested that caffeine can stimulate hair shaft elongation and may counteract some of the suppressive effects of dihydrotestosterone, or DHT. DHT is a derivative of testosterone formed by the enzyme 5-alpha reductase, and it plays a major role in androgenetic hair loss, the most common type of thinning in both men and women. In individuals who are genetically sensitive to DHT, hair follicles gradually miniaturize. The growth phase shortens. The hair shaft becomes thinner. Over time, the follicle may produce barely visible strands. Caffeine appears to influence intracellular signaling pathways, particularly cyclic AMP, which can enhance cellular energy metabolism. It may also improve local microcirculation in the scalp, potentially increasing blood flow and nutrient delivery directly to the follicle. So while zinc works by ensuring your body has the raw materials for healthy cellular function. Caffeine may act more like a local stimulant, nudging the follicle to remain metabolically active despite hormonal stressors. These are two completely different strategies. Zinc supports the internal environment. Caffeine interacts with the external microenvironment of the follicle. This distinction matters deeply. If your hair thinning is caused by nutritional deficiency, poor diet, malabsorption issues, or restrictive eating patterns, caffeine shampoo alone will not correct the root problem. You could stimulate the follicle locally, but without adequate systemic support, the cellular machinery still lacks essential components. Conversely, if your zinc levels are perfectly normal and your thinning is primarily driven by androgen sensitivity, taking additional zinc may not meaningfully alter the trajectory of follicular miniaturization. This is why so many people feel disappointed. They use one tool, expecting it to solve every mechanism involved in hair loss. But biology is layered. There's another layer to consider as well: inflammation and immune balance. Zinc plays a role in immune regulation. Inflammatory scalp conditions such as seborrheic dermatitis can contribute to increased shedding. In such cases, zinc, particularly in topical forms like zinc pyrithione, can help reduce microbial overgrowth and calm inflammation. Caffeine does not primarily act as an anti-inflammatory mineral. Its influence is more metabolic and stimulatory. And then there is the question of delivery. Zinc supplementation works systemically. It enters the bloodstream, distributes to tissues, and participates in enzymatic reactions throughout the body. However, excess zinc can interfere with copper absorption and immune balance, which is why dosage matters. More is not better. Caffeine shampoo, on the other hand, depends on scalp contact time. Most people rinse shampoo within 1 to 3 minutes. Some studies suggest caffeine can penetrate follicles relatively quickly, possibly via the hair shaft route. But the real-world magnitude of that effect varies depending on formulation and consistency of use. So when someone asks, which one is better? The medically honest answer is, it depends on what problem you are trying to solve. If the issue is systemic nutritional insufficiency, zinc plays a foundational role. If the issue is localized follicular stimulation in the context of androgen sensitivity, caffeine may offer supportive benefit. But here is something even more important. Hair health rarely depends on a single variable. Hormones, stress levels, sleep quality, insulin sensitivity, thyroid function, scalp health, genetics, and nutrition all intersect. Caffeine and zinc each address only one piece of that larger puzzle. When you understand that, you stop viewing them as rivals and start seeing them as tools with specific purposes. And that perspective changes how you make decisions. Instead of asking, what's trending, you begin asking, what does my biology need? If you have signs of zinc deficiency, poor wound healing, frequent infections, loss of appetite, or laboratory-confirmed low levels, correcting that deficiency can absolutely improve hair shedding over time. If you have early androgen-related thinning and want a low-risk supportive topical strategy, Caffeine shampoo may offer mild benefit when used consistently and realistically. Neither is magic. Both are logical within context. The surprising truth is not that caffeine defeats zinc. It's that they operate on entirely different pathways. One nourishes the system. The other interacts with the follicle locally. And your job is not to choose sides. Your job is to understand the root cause of your hair thinning, because once you identify that, the choice becomes obvious. Clarity replaces guesswork. Strategy replaces impulse. And that shift alone reduces the stress that so often worsens hair shedding in the first place. When you respect the biology, the decisions become calmer. And calm decisions lead to better long-term outcomes. That's how real progress begins. If you've been losing hair and no one has been able to give you a clear answer why, it's not because your case is mysterious. It's because hair thinning is not a single condition. It's a signal. And until you understand what your body is signaling, every treatment will feel like a guess. One of the biggest misconceptions in hair health is the idea that hair loss is one problem with one solution. In reality, thinning hair is a symptom with multiple potential root causes: hormones, DHT sensitivity, chronic stress, inflammation, impaired circulation, and nutrient deficiencies can all influence what happens at the level of the follicle. And often, more than one of these factors is involved at the same time. One of these factors is involved. Hair follicles are highly responsive to hormonal signaling. They are not passive structures. They contain receptors that respond to androgens, thyroid hormones, insulin, cortisol, and even growth hormone. When these signals are balanced, the hair cycle remains stable. When they shift, the follicle responds. The most well-known hormonal driver of thinning is DHT, or dihydrotestosterone. DHT is derived from testosterone through the action of an enzyme called 5-alpha reductase. In individuals who are genetically sensitive, DHT binds to receptors in the hair follicle and gradually shortens the growth phase, known as an agent. Over time, the follicle miniaturizes. The hair becomes thinner, shorter, and eventually may stop emerging visibly. But here's the nuance. DHT itself is not bad. It's a normal hormone with important roles in the body. The issue is follicular sensitivity. Two people can have similar hormone levels, yet one experiences thinning while the other does not. That tells us that genetics and receptor responsiveness matter, just as Chaz, hormone quantity. Now consider thyroid hormones. Both hypothyroidism and hyperthyroidism can disrupt the hair cycle. Thyroid hormones regulate metabolic rate, and hair follicles are metabolically active structures. When thyroid signaling is low, cell turnover slows. When it is excessively high, the cycle can become unstable. In both cases, diffuse shedding can occur. Insulin resistance is another overlooked contributor. Elevated insulin levels influence androgen production and inflammatory signaling. Chronic high insulin can indirectly amplify DHT activity. It also affects microvascular function, which influences nutrient delivery to the scalp. And then there is stress. Chronic psychological or physiological stress increases cortisol. Elevated cortisol can prematurely push hair follicles from the growth phase into the resting phase, a process known as telogen effluvium. This type of shedding often appears several months after a stressful event, surgery, illness, emotional trauma, severe dieting. Patients are often confused because the hair loss doesn't happen immediately. After the stressor, it shows up later when the follicles have completed their shift into the resting phase. Without understanding this delay, people assume the cause must be something else. It can alter androgen metabolism, disrupt sleep, and increase systemic inflammation. All of these ripple effects influence the follicle. Inflammation itself is another root cause. Low-grade chronic inflammation can damage the microenvironment of the scalp. Inflammatory conditions such as seborrheic break dermatitis, psoriasis, or autoimmune disorders can interfere with follicular stability. Even subtle inflammatory signaling driven by poor diet, gut imbalances, or metabolic dysfunction can influence hair cycling. Inflammation affects blood vessel function and cellular communication. Hair follicles depend on a delicate exchange of growth factors and cytokines. When inflammatory mediators dominate, the growth phase can shorten. Right, circulation is another piece of the puzzle. Hair follicles require oxygen and nutrients delivered through tiny blood vessels. If microcirculation is compromised, whether from smoking, chronic stress, vascular dysfunction, or metabolic disease, the follicle's energy supply decreases. While circulation alone is rarely the sole cause of hair thinning, it can compound other factors. Nutrient status must also be considered. Hair is made primarily of keratin, a protein. Adequate protein intake is fundamental. Beyond that, iron, zinc, vitamin D, B vitamins, and essential fatty acids all support different aspects of follicular function. Iron deficiency, particularly in women, is a common contributor to diffuse shedding. Zinc deficiency can impair cell division. Vitamin D plays a role in follicle cycling. Severe caloric restriction can shift follicles into the resting phase as the body prioritizes essential organs over hair production. Notice the pattern here. Each of these factors influences a different biological pathway. Hormones affect receptor signaling. Stress alters cortisol and inflammatory balance. Nutrients provide raw materials for cell division. Circulation supplies oxygen. Inflammation modifies the microenvironment. The follicle integrates all of these signals. That's why hair thinning cannot be reduced to a single explanation. It's a multi-system reflection of internal physiology. This is also why quick fixes often disappoint. If someone with iron deficiency uses a topical product targeting DHT, the root cause remains unaddressed. If someone with androgen sensitivity focuses only on nutritional supplements while ignoring hormonal influence, results may be limited, often overlap. Chronic stress can worsen insulin resistance. Insulin resistance can amplify androgen activity. Inflammation can impair circulation. Nutrient deficiencies can heighten stress sensitivity. It becomes a web rather than a straight line. Understanding this complexity should not feel overwhelming. It should feel empowering. Because once you recognize that hair thinning is a signal, you stop blaming yourself, you stop assuming it's random or irreversible, you start asking better questions. What has changed in the last 6 months? Have there been shifts in stress, sleep, diet, weight, or health status? Is there a family history suggesting and androgen sensitivity? Are there symptoms of thyroid imbalance or iron deficiency? Hair loss is rarely the body's first warning sign. The body's first warning sign. It often reflects changes that have been developing quietly beneath the surface. This perspective also changes how we approach treatment. Instead of reacting emotionally to shedding, we move toward evaluation. Blood work can provide insight into iron levels, thyroid function, vitamin D, and sometimes zinc. A medical evaluation can assess patterns consistent with androgenetic hair loss versus telogen effluvium. Most importantly, patience becomes part of the equation. Hair cycles are slow. Even when the root cause is corrected, visible improvement can take several months. The follicle needs time to re-enter the growth phase and produce thicker strands. Emotionally, this waiting period can be difficult, but understanding the biology reduces panic. It reframes the experience from crisis to process. If you've been feeling frustrated, know this. Hair thinning does not mean your body is failing. It means something has shifted, and shifts can be identified. When we look at hair through a systemic lens, we move away from one-size-fits-all solutions. We acknowledge that hormones, DHT sensitivity, stress, inflammation, circulation, and nutrient status each play distinct roles. And when you address the right combination for your body, progress becomes more realistic, not instant, not dramatic, but steady. And steady improvement, grounded in physiology, is far more reliable than chasing trends. Hair thinning is not one condition. It is a reflection of interconnected systems communicating with you. When you listen carefully and respond thoughtfully, you shift from reacting to understanding. And understanding is where real change begins. If you've been searching for that one product, the shampoo, the supplement, the serum that promises to finally fix your hair, what I'm about to say may feel both disappointing and deeply relieving. Sustainable hair improvement rarely comes from a single bottle. It comes from understanding your root cause and committing to a long-term strategy that supports your biology consistently. That doesn't mean products are useless. It means they are tools, not solutions in isolation. It follows a biological rhythm that cannot be rushed. The hair cycle moves through growth, transition, and rest phases over months, not days. So when we talk about sustainable improvement, we're talking about aligning with that timeline instead of fighting it. The first pillar of long-term success is proper assessment. Before choosing interventions, you need clarity. What type of hair thinning are you experiencing? Is it androgenetic, driven by genetic sensitivity to DHT? Is it telogen, effluvium, triggered by stress, illness, or dieting? Is it related to thyroid imbalance, iron deficiency, or other nutritional gaps? Without identifying the root cause, treatment becomes guesswork, and guesswork leads to frustration. A thoughtful assessment may include blood work to evaluate iron levels, thyroid function, vitamin D, and possibly zinc. It may involve a clinical examination of the scalp to assess miniaturization patterns. It may require reviewing lifestyle changes from the past 3 to 6 months, since hair shedding often reflects past events rather than current ones. This investigative phase is not dramatic, but it is powerful, because once you identify the mechanism, your strategy becomes targeted instead of reactive. The second pillar is consistent lifestyle support. Hair follicles are metabolically active structures. They require protein, micronutrients, oxygen, hormonal stability, and low inflammatory signaling. None of those factors depend on a single topical product. They depend on daily habits. Nutrition plays a foundational role. Hair is composed primarily of keratin, a protein. Insufficient protein intake can impair follicular output. Beyond protein, iron supports oxygen transports. Zinc supports cellular replication. B vitamins participate in energy metabolism. Vitamin D influences follicle cycling. This does not mean megadosing supplements. It means ensuring adequacy. Whole foods rich in lean protein, healthy fats, vegetables, and micronutrients create the internal environment in which follicles can thrive. Sleep is another critical factor. During deep sleep, growth hormone supports tissue repair and regeneration. Chronic sleep deprivation disrupts cortisol balance and insulin sensitivity, both of which influence hair cycling. Many people underestimate the cumulative impact of poor sleep on hormonal stability. Stress management is equally essential. Elevated cortisol can prematurely push follicles into the resting phase. Psychological stress also alters immune and inflammatory signaling. Sustainable improvement requires reducing chronic stressors where possible and building resilience where they cannot be eliminated. Exercise contributes by improving circulation, insulin sensitivity, and inflammatory balance. Better microcirculation supports nutrient delivery to the scalp. Again, this is not about extremes. It is about consistency. The third pillar is realistic expectations. One of the most damaging aspects of the modern hair care industry is the promise of rapid transformation. But biology does not operate on marketing timelines. When a follicle shifts from rest back into growth, it takes time before the hair shaft becomes visible above the scalp. Even effective interventions typically require 3 to 6 months before measurable changes appear. Switching treatments every few weeks interrupts progress. It also increases anxiety, which paradoxically may worsen shedding too. A strategy for an adequate duration before evaluating its effectiveness. It means tracking progress objectively, perhaps through monthly photographs under consistent lighting, rather than relying on daily mirror inspections. It also means accepting that perfection is not the goal. Genetics play a role in hair density and pattern. Age-related changes occur gradually. The aim is optimization, not reversal of every biological influence. Another component of long-term strategy is early intervention when appropriate. In androgenetic hair loss, follicles gradually miniaturize over time. The earlier supportive measures are implemented, the greater the likelihood of preserving density. Waiting until thinning becomes advanced reduces the number of responsive follicles. However, early intervention should still be thoughtful, not aggressive, not desperate. For some individuals, medical therapies may be appropriate. For others, addressing metabolic health or correcting deficiencies may be sufficient. The key is matching intervention intensity to the underlying mechanism. Avoiding harmful practices is also part of sustainability. Tight hairstyles that create traction can damage follicles. Excessive heat, styling weakens hair shafts. Harsh chemical treatments irritate the scalp. Gentle care protects what you are working to preserve. Another overlooked factor is emotional mindset. Hair thinning often triggers fear. Fear leads to urgency. Urgency leads to impulsive decisions. Impulsive decisions disrupt consistency. When you understand that improvement is gradual, you create space for patience, and patience reduces stress-related hormonal disruption. This doesn't mean ignoring the issue. It means responding with strategy rather than panic. Sustainable hair improvement is similar to improving cardiovascular health or metabolic health. There is no single pill that replaces daily habits. The body responds to patterns, not isolated actions. Consistent nourishment, stable sleep, managed stress, targeted treatment when indicated, gentle scalp care, periodic reassessment. These layers reinforce each other. Over time, small improvements compound. Reduced inflammation supports better circulation. Better sleep stabilizes hormones. Stable hormones protect follicles. Adequate nutrients sustain growth. It becomes a reinforcing cycle rather than a deteriorating one. And here is something important to remember. Even stabilization is success. If you slow progression, maintain density, or reduce excessive shedding, that is meaningful progress. Not every win looks dramatic. Some wins look like prevention. In a culture that rewards instant results, embracing long-term biology feels almost radical. But it is realistic when you shift from searching for the best product to building the best environment for your follicles. You move into a position of control. Products can support the process. They may enhance circulation, modulate hormonal pathways, or reduce inflammation, but they function best when layered onto a stable foundation. Without that foundation, they struggle. Outrage improvement is not glamorous. It is disciplined, patient, and informed. It respects physiology instead of fighting it. And perhaps, most importantly, it protects your mental well-being. Because when you stop chasing miracles, you start building stability. If you take one idea from this, let it be this. Your hair reflects your internal ecosystem over time. Support that ecosystem consistently, assess thoughtfully, adjust strategically, and allow biology to respond. There may not be a single product that changes everything overnight, But there is a strategy that changes the trajectory, and that trajectory, steady, informed, sustainable, is where real progress lies.